Hi, my name is Nat and I'll be speaking to you today about adolescent HIV prevention. So some of you may or may not know about HIV. I want you to think to the last time you heard about this disease. Do you know personally anybody with HIV? And why is this doctor standing here talking to me about this today? And how is it relevant to my medical education in Thailand? So we're here to speak to you about this. So some of you may watch Netflix and some of you may personally know people with HIV, and some of you may know people in the media. You can see here Jonathan Van Ness, some of you, if you watch The Fabulous Five on Netflix, is famously out with his HIV diagnosis. Or a couple of years back in the movie Bohemian Rhapsody, the lead actor also was somebody that suffered with HIV. What happened in that scenario, and how is it relevant to our practice now? Or even in the Thai media, if you were around a couple of years ago, Pete Lertborg, or Pete living with HIV, he came out and said, you equals you. Nobody needs to use condoms anymore, even if they have HIV. How true is that? So today we'll be discussing these topics in our next 15-minute talk. So today I'll be talking about a case study that came to our hospital a couple of years ago. And for medical students, what are the points of interest that you can learn from this? And also, in addition to what everybody knows already, condoms, we know that those can be used to prevent HIV. But why are people still having HIV infections? And what can be done to prevent these infections? So we start with this young man who came to our unit about 3 years ago. He was a 16-year-old men who have sex with men, so a young gay man who had left his home in Isan in northeast Thailand and came to Bangkok, and he was rejected by his family because he was gay and quite heavily stigmatized for this. And his income, sadly, was as a sex worker. And you may think that this is unusual, but actually it's surprisingly common when you start to come into practice. And his work involved multiple clients. So we had adult clients, young men as well. He also had multiple boyfriends, and shockingly to us said that he'd never used condoms. So you're the doctor sitting in the office, and this young person is sent to you, and they said, well, this person has a new HIV diagnosis, his first HIV test in his life, and he says that he wants to kill himself. Please help us, doctor. What's the first thing that you would do in this situation? So you may be thinking, wow, this is really complicated, lots of different things going on. How should I approach this case? So in this scenario, I would suggest maybe start with an assessment. What are the clinical issues that I need to manage for this patient? And in terms of the plan, once I've decided what problems this patient has, what are the specific things I need to do to help this patient? And the second thing is, what do I need to do in general for their health to make them healthier? And number three, of course, the focus of today's talk is prevention. How could we have prevented this happening to this patient? And the other thing is, what about his sex partner and his other sex partners before this? How could this have actually been prevented with those people? And with his immediate sex partner this time around, what do we need to do immediately to stop that person getting HIV? So in this case, I would suggest that obviously the main problem is he has a new HIV infection that needs to be treated. And of course, many of you will have decided when you were listening to me a couple of minutes ago that this person is suicidal. He needs management straight away. And of course, he's under 18. He's still a vulnerable young person that in addition to the medical help he needs the social help as well. So let's go on to the specific treatment first in the next slide. So in terms of the specific treatment, of course, we're thinking about antiretroviral therapy here. And if you look at the US guidelines, DHHS guidelines, there are Thai national guidelines, WHO guidelines, there are several guidelines around the world that you can use in relevance to your local settings, what medications you would use. The main medications currently used are integrase inhibitors or dolutegravir-based regimens at the moment. But if you'd like to know more about that, there are plenty of sources that you can read more about. And of course, the second thing is the suicidal ideation, which is also an emergency where it's a good idea to give some counseling and also start antidepressants if the patient is open to that. And the second thing is also supportive. So we talk about this a lot in pediatrics, where in addition to the medical therapies, the supportive therapies, whether that's from friends and family, have we asked this person, have they disclosed the diagnosis to their close people, and who is there to support them? How is this going to affect their work and studies? And have we advised them for that already? And of course, the final thing that is the focus of today's talk is prevention. How could we have prevented this infection from happening to him? And what about his partner? What do we do now? Has he even told his partner? So I know that most of you are thinking, okay, so we could have provided him condoms at some point, but what about other things? Is there anything else that's available at the moment? So this is taken from maybe over 10 years ago, and it's the old-fashioned way to prevent HIV. So abstain, so not have sex. B, be faithful. 3, condomize. And D, in those days, or you will die, which seems pretty extreme. And in today's world, we now have replaced this with PrEP. So what is PrEP? How many of you have heard of this medication before? You may have seen it on the news, or maybe it's new to you today. So here we're here to discuss about that. So it stands for pre-exposure prophylaxis. And you can see this advertisement from San Francisco about maybe 10 years ago now when the medication first came out. So it's a medication that's taken to prevent you from getting HIV if you know that you may or may not be exposed to it. So the question is, so how do I know that I need to be advising this to my patients? So globally, there are a main population that are at risk of HIV. And if we go back to the slides that I just talked about in the beginning, you'll notice that these people in the media are all LGBT. They're gay, they may be transgender, and of course the key thing to notice is these people are people who have anal sex. And so that's the thing that I want you to remember with how effective PrEP is it's very helpful for people who have anal sex, but is also helpful to prevent HIV in people who are not people who have sex anally as well. So how can PrEP be taken? How can I prescribe this to my patients? So the main form that PrEP is available in Thailand at the moment is a mix of 2 NRTIs, M-tricytidine and tenofovir disoproxyl fumarate, which can be taken as a single tablet once a day, taken with or without food. So that's called daily oral PrEP. If you are a man who has sex with men or an MSM, another option that you may have seen in textbooks or online at the moment is what's called event-driven PrEP, which is on-demand PrEP. And these are guidelines that, if you're interested, you can look for details further online through the WHO guidelines. So you take medications before you think you may have the sex act, and also medications after you have the sex act. And you might ask, well, how effective is this? And if I'm prescribing this to my patients, do I still need to be telling them to use condoms as well? And the answer to the first question is the efficacy is about 92 to 100%, but only if taken as prescribed. And this is a very important thing as doctors that you need to be emphasizing to your patients, because it's only effective if taken, as we've talked about here, once a day, or as prescribed 2 tablets before the risk event and 2 further tablets once a day after the last sex act. And remember to emphasize with your patients that although PrEP is a chemical barrier, it's a chemical barrier to prevent HIV only, but it does not prevent other sexually transmitted infections, which of course we know comes with condomless or unprotected sex. Another thing I want you to remember is, although we're talking about HIV prevention here, if somebody has a sexually transmitted infection, they're also much more at risk to get HIV. So by treating sexually transmitted infections, you're actually reducing the risk that they will also acquire HIV. So we've talked about pre-exposure prophylaxis today already, and its effectiveness is backed by many clinical trials and research. But of course, the downside is, especially when you're talking about adolescents, you may have been an adolescent maybe just 5 or 6 years ago, or maybe an adolescent at the moment, and you know that taking a drug every day is not easy. And also, some people may not know where to get PrEP. But another option you may or may not have heard of is post-exposure prophylaxis, or PEP. And this is an option, going back to the case that we just discussed, that they could use. So we could ask him, when was the last time you had sex with your boyfriend? And if that was within 72 hours, that is another option that we can give and offer his boyfriend to take for 28 days to reduce the risk of getting infected with HIV. Another thing that we touched on at the beginning of this talk is this concept of TASP, or treatment as prevention, which refers to what Pete Ledborg, or Pete Living with HIV, was talking about when he said, oh, if you are living with HIV, you don't need to use condoms anymore to stop HIV passing on to your partner. And this refers to this concept of U equals U. So you may be thinking, really? I don't need to recommend my condoms to my patients anymore? And the answer is, in a way, yes, but in a way, not. So this is based on information from clinical trials where if you take HIV medication daily, up to the point where your HIV viral load is undetectable, clinical trials have shown that you effectively have no risk of passing sexually transmitted HIV to your partners. And so hence this concept of undetectable being untransmittable. And so in essence, what Pete Ledborg, or Pete Living with HIV, said was true, but only for HIV. And also another thing, since we're talking about adolescents in this talk, is only relevant if you only have two people in the equation. So if you have somebody who is still detectable because they may or may not be taking their medication all the time, or the other partner is having other sexual partners where they may be acquiring HIV elsewhere, this doesn't apply. So this is close to one of the final slides I'll be talking about is what does UNAIDS recommend we do to prevent HIV? So apart from condoms, PrEP and PEP that we've discussed, what else can we do to prevent HIV? And you can see on this, there are multiple things that as a doctor you can do to prevent HIV. So it's not just sexually transmitted. We know that HIV is transmitted through sharing of intravenous needles as well, and so needle exchange is important. So we have PrEP and PEP here, but remember that what is green here is only the biomedical interventions. You can see here that there are also behavioral interventions. So what does that actually mean? So we're talking about things like HIV testing, and risk reduction counseling. So the adolescent that we talked about in the beginning, how much do they actually know about PrEP? Did they know that they could recommend PEP to their boyfriend? And were they able to say no if their boyfriend said, oh, I don't want to use condoms? How are we giving skills to our patients to use those skills to prevent HIV that way around? And also in terms of structural interventions, how youth-friendly are our services, and how easy is it for them to come and see you when they need these services? So my take-home message, hopefully in the last 15 minutes, you'll have gotten more of an idea that in Thailand, adolescent MSM and transgender women, or anybody who has anal sex, the most at-risk people of acquiring HIV, and therefore in your practice, after you qualify, are a population that really need your support to prevent HIV, both in Thailand and even if you work overseas, are still a very important population to look after to prevent HIV. And we've heard today that HIV prevention can happen in many different forms, whether it's pre-exposure prophylaxis, post-exposure prophylaxis. We're not forgetting condoms because they're still very helpful in preventing both HIV and sexually transmitted infections. Remember to screen for and treat sexually transmitted infections to reduce the risk of getting HIV. And also to remember that U equals U, or undetectable equals untransmissible, is something that you can use in people who are in a stable relationship. And also always remember all of the other systemic things that are important to help our patients not get HIV, such as caring for partners and also helping them access your clinics. So thanks for your attention today, and I hope that it was a useful talk.